Chapman. I'm a physician in Roanoke, Virginia, and I came here to speak on the concern of the off-label prescription use. Senator Donovan, I understand your concern, and that's my concern as well. The real issue here is the pharmacies are not filling the prescription. The doctor writes it, the patient takes it there, and the pharmacies refuse to fill it. In Roanoke, when I had COVID in October, me and my wife, we got our prescription from our doctor, but there was only 2 pharmacies in Roanoke that would fill it. We did finally get it filled, we did fine. The other concern with this is if we start limiting off-label use, as you know, my specialty, that's half of my practice. That's every day, there's thousands and thousands of prescriptions that are written for off-label use. We want to curtail the use of narcotics in pain management. Well, what do you think we do? We go to off-label use of other things, neurotic, Lyrica, things like that, so that we have other options besides narcotics. So this not having some protection over the off-label use of the medications is going to be critical for continuing to provide care for patients. I appreciate your concern. Maybe we need to take another approach to find out how is it that a pharmacist can take a prescription written by a doctor and say, no, we're not going to fill it. We don't care what you do.
Mr. Chairman,
Thank you. Yes.
just to comment and keep the conversation going, we're going to get some information from the board about whether or not there are being doctors that are tracked. I think if we looked at this, we'd see these are corporate decisions. We know almost all the pharmacies now are big conglomerates, and this is not an individual pharmacist even within their power to make the decision, because they have corporate decisions that we don't agree with. But off-label is protected by the federal government. We have the right to prescribe whatever we think, as long as we consent that patient, we have the right to prescribe off-label.
All right, time is up. We need to move along, so the last people come up and tell us your name and tell us your position, and let somebody else come up. So.
Well,
Yeah.
thank you all for taking the time to hear from all of us today. My name is Philip Andrew Hamilton. I actually ran for the Virginia House of Delegates in Charlottesville last year. While I did not win, I'm here as a citizen fighting for medical freedom and for medical treatment. And medical freedom involves, we're not talking just about the mask mandates and vaccines. This is a very tailored issue.
Yeah.
And
Can you try to move along quickly, because we don't have,
Yeah.
we don't have time. So
I support the
get
bill.
directly to the bill and let us know your position.
Sure. So I support this bill 100%. It's gonna save lives. And I'm friends with Dr. Sheila Fury. I've heard many of her stories. Patients who, their lives have been saved by the protocol that she's enacted. And these are things that you should take seriously, because we shouldn't have Virginians traveling to other states that get the treatment that they deserve. This legislation will prevent that from happening.
All right.
So again, support this bill.
Thank you. Thank you. All right, next.
My name is Bonnie Stewart, and my daughter went to college in August at Liberty University. My husband and I went there 2 weeks after she started school. She got COVID. We went to help her there. We both got COVID. My husband's been went to Lynchburg General. We called the same pharmacy in Lynchburg to get our ivermectin before he was admitted to the hospital. He was admitted to the hospital on September 12th, and he was intubated on September 25th. And he was airlifted from Lynchburg General, where he would not have made it, to UVA Medical Center on October 1st. Governor Bob McDonnell, previous governor, he made the call to UVA and got a bed for my husband. And my husband right now is facing a lung transplant. If he would have got ivermectin, it would have taken the inflammation out of his lungs. And right now, he's on the ventilator at 5 months. He's on the ventilator at UVA. And we were just told, I am not able to see him because of the mandates right now with not being allowed to go into the hospital. And I was just told on Saturday that my husband needs a lung transplant. He's 57 years old. He's a Navy veteran, and he served in the Gulf War. And he was a picture of health. Had he gotten ivermectin when we ordered it and had it sent to the pharmacy there, We're from Virginia Beach, and I've been going back and forth. And so this is so personal to me right now that please, please consider this bill.
Thank you. Madam Chair, I have a question. My question is, your husband, was he vaccinated before? Was he
No,
vaccinated?
he wasn't.
Thank you.
My name is Kimberly Eastman. I was hospital bound by day 10 because my oxygen level had dropped below 90 and my primary care physician offered no treatment. I can say unequivocally that the MAP Plus protocol, including ivermectin, kept me out of the hospital and I believe saved my life because on day 11, I came under the care of an FLCCC doctor. I do want to address the cost of the ivermectin and the ability to get it. There was one compounding pharmacy in Richmond that was doing it, and they stopped doing it in the middle of my treatment. And they told me because the Department of Health had come down on them. So for whatever that means. You and your loved ones and all of our fellow Virginians should have access to the same type of life-saving care.
Try to make it quick.
Thank you. My name is Pamela Burnham. I was a critical care nurse and a hospital assistant for many years. I've worked with infectious disease patients all over the country. When COVID hit, I knew the system was broken when people told to go home until they couldn't breathe. I alerted my community and my friends. I have been advocating primarily for COVID patients and families for close to 2 years now. I encouraged everyone I knew to stock up on meds. I've helped probably close to 1,000 people. They're terrified of the hospital system.
Trying to address the issues in the bill.
Okay. Well, our entire family was hit by the Delta variant, including my 87-year-old mother-in-law. Our family was hit very hard. I've helped both vaccinated and unvaccinated people recover from COVID. Early outpatient label treatment with many FDA-approved medications like ivermectin and hydroxychloroquine, along with vitamins and antibiotics have been life-saving, as everybody has stated here today. Overwhelming evidence is available by frontline physicians. I support patients' right to try any legal medication that their physician thinks is appropriate based on their professional clinical judgment. Please do not prohibit off-use label. Okay.
Try to go.
Right. I'm Barbara Zedler. I'm a recently retired physician after more than 30 years of practice in internal medicine and scientific research, and I speak in strong support of this bill and to provide some clarity for people who are not necessarily as familiar with what it means, these terms. FDA approves medications as safe and effective for at least one disease or condition or use, okay? That's in the label. They do not control how physicians, in their professional judgment, prescribe those medications to treat patients. Off-label use, meaning for other conditions, other doses, other frequencies, other patient populations such as children or people with renal impairment, that is legal and common for FDA-approved medications for almost everyone. I dare you to find one that isn't used off-label for another condition. And that comes from use, real-world evidence developed after decades of use in patients, that they're useful for other conditions. In fact, an average of 20% of commonly used medications are prescribed off-label every day. And in some populations like children, pregnant women, cancer patients is a far higher proportion. If you prohibit that, you will lose the ability to treat those. Let doctors be doctors and do not allow the Board of Health Professionals, the Board of Pharmacy, or corporate pharmacy and hospital systems to persecute them for complying with legal and long-standing best medical practices. I thank you.
We're over time here, so.
Real quick. Okay, so we all have liberty, and that includes our right to try life-saving
the pharmacists that are infringing upon our liberty are actually in violation of real law.
Good morning, my name is Chris Nestor. I practiced pharmacy for about 34 years. I retired about 10 years ago. I worked at VCU Medical Center. I share with Dr. Dudley some of your hesitancy about removing the ability for a pharmacist to deny filling a prescription, because misprescribing can and does happen, and he's a line of defense, just like a nurse is. But to your point, Senator,
Yes.
when you asked about the whether the woman had been vaccinated or not, it seems to me that when experimental medicine like the so-called vaccine is recommended for 100% of the population, that's unprecedented. I've never seen that before. It seems to me what should happen is recommendations can be made, but a patient has a math problem. They need to decide whether they want to risk the problems that can result from taking a new vaccine that usually takes at least 5 years to evaluate, or seek available treatment such as what's been discussed here. I rise in defense of heightening awareness of this ridiculous thing. I've never seen, medicine will never be the
Your time
same.
is up. Thank you.
This is very hard on me.
Yeah.
Staying in front of y'all, I get more nervous,
Okay.
but I feel like I need to say something about my mother, especially to you, sir. She's 82 years old. She caught COVID, almost died. I had a wonderful doctor, Dr. Flurry, tell me what I needed to do to help her. And it worked. It really did work. Including with the Math Plus protocol in ivermectin, my 82-year-old mother would not be here. And that's the truth. So please,
Thank you.
let this bill pass, please. It does work.
Is there anyone who wishes to speak in opposition to the bill? All right, there's a motion to pass it by indefinitely.
Speak to the motion.
Second.
Can we speak to the motion real quick?
Yes.
Just speaking to the motion, I'm gonna vote, pass by indefinitely means to defeat the bill. So I'm gonna vote against that motion. But speaking to it, I have some serious concerns with how this legislation is formatted. I've spent more time trying to review our pharmacy conscious provisions, and I have very serious concerns that, as it's currently before us, and so I'm not gonna vote to kill it. I think the conversation should continue, but I think the way that this is currently composed could require some of the pharmacists that I represent that would not be willing to prescribe abortifacients to do so.
Yep.
And that is something that is very problematic, and I will not vote on the floor of the Senate for such a bill. But I'm not gonna vote to defeat it because I want the conversation to continue, but I know Senator Chase does not wanna do that to pharmacists in Virginia either, but this is a big problem. This is a big problem with how it's currently constructed.
All right, let me
Mr. Chairman.
point out that the vote that is taken today is not gonna be the final action on this. This will go to the full committee regardless of what happens or does not happen today in terms of a motion, and so we'll be dealing with this next Thursday, so.
And Mr. Chairman, there's a willingness of myself to work with members of the committee to satisfy, I have the same concerns that you do, which which is why I had the original bill, so it was more narrow focused to avoid that type of situation. So I'm in agreement.
We have a motion and a second.
Before we go, and I know we're in a hurry, but there's a couple things that matter here. One have there been physicians that have been disciplined because of their decision? If so, I'd like to know about that.
And the board of MBAs,
Yes, they've
So
been
this is what-
fine.
Have you disciplined physicians for doing off-label use of drugs? Has that been your practice?
Mr. Chairman,
Yes.
Senator David Brown, Department of Health Professions, no.
Have you ever disciplined a physician or others because of off-label use of a drug?
No, we have not taken action against the physician for off-label
Are you
prescribing.
parsing the words taken action? Has there been anything that you've done?
I'm not parsing words. There have not been
Okay.
cases that have involved off-label prescribing. There certainly are cases of inappropriate prescribing, excessive prescribing of opioids and things like
But
that.
nothing on these drugs, is that correct, sir?
That's correct.
I'm sorry, Mr. Chairman. David, thank you for your answers. They've got to be very direct, and I apologize for that. Have you or anyone in the Department of Health gone after pharmacists for prescribing off-label drugs as mentioned in this bill?
No, sir. And I would like to just clarify that it's my understanding that pharmacists have an obligation to not fill prescriptions that they believe to not be legitimate. And so the board has not taken any action, but there is language, which I think is what results in some pharmacists filling something and some pharmacists not filling something in addition to the corporate.
My question is more narrow, right?
Yes.
So the narrow question is, has the board or others in the Department of Health threatened pharmacists with action
No.
based on these drugs?
No, sir.
So, Mr. Chairman, and I know I took a couple minutes of the time, but a couple of things. One, I think David's concern here is a magnificent concern. We cannot overlook the mandating of anyone to prescribe something that they morally disagree with, so that it just has to fix. The other thing is that I think we've got to be very clear. Thank you, David, I appreciate it. Very, very clear, because to me, and I'm just one little guy at 40, if the Department of Health is out there doing this, or we find out that the Department of Health is out there doing this, I think there ought to be, because we're very clear that off-label usage is okay. And if it's not okay, we need to change some people in the Department of Health. That's just the way I would go about that. So to me, I didn't vote, I abstained on your other bill because it was not a broader bill. And I like this one for the broadness. The problem is the David concern. So I'm not gonna vote to PBI it, but I'm with David. If this problem related to RU 486 or otherwise is not fixed, I can't support it either. So I urge you guys to kind of work your way through that. And I'd like to make sure that we understand if somebody out there says that they've been disciplined by the Board of Health, or if the health department has come down to pharmacy, I think this is a call to bring that information in so we can actually find it. Thank you, Mr. Chairman.
All right.
Mr. Chairman,
Thank you.
I'm so sorry. I'm sorry to the committee that I feel it's very important that I speak on this. And I will say, I hear your passion. I get it. I get that doctors and patients should be able to look at any alternative that's out there, weigh and balance the positives and negatives, and make a decision about what that patient actually decides. We are informers, the patients are decision makers, and that has been obstructed in this situation.
Yeah.
This bill doesn't accomplish what you want, and that's the problem. And that I will not be able to support this bill because I have to have a principle about the state not getting involved in that conversation between a provider and a patient. And unfortunately, despite the best content, this bill does that. And so I just wanted to say that I have already texted the acting commissioner of the Department of Health to find out if any pharmacy was in any way discouraged for dispensing this medication. And I'll get answers and I'll make sure that I put them out there. And we'll follow up, but physicians have the right to prescribe off-label. Can't answer questions. Prescriptions we can talk after. Prescriptions have the right to prescribe off-label. Patients have the right to try medications that they think might help, even if they're off-label. And I understand that's a problem, and I'm sorry about that, but this bill doesn't fix it.
All right.
Mr. Chairman, could I just finish with one last comment?
Not right now. No, sorry. we're well over time here, we've devoted a lot of time to this, so so we have a motion and a second, to recommend passing the bill by, indefinitely. And regardless of what the outcome of this vote is, this will go to the full committee next Thursday, so call the roll.
Senator Saslaw. Senator Newman. Senator Edwards.
Aye.
Senator Lewis.
Aye, by proxy.
Senator Donovan.
Aye.
Senator Suderline.
No.
Senator Pillion. Senator Barker.
Aye.
Ayes 5, noes 3.
All right. And we will take it up again next Thursday, so. All right, we are running.